At ASCO GI 2021 Virtual Congress, we will be presenting, my colleague Dr. Moy is presenting genomic characterization of comprehensive collection of our esophageal and gastric cancer patient-derived xenografts. PDXs can be a critical tool in learning biology and also accelerating drug development in gastric cancer. And historically, the models that are used for studying this disease are purchased through repositories and have been used over and over again through several passages and may not recapitulate what we see in the patient. So what's unique about our PDX program is these are tumors that are implanted from endoscopic biopsies or biopsies of liver metastasis or other visceral organ metastasis, and are passaged only a limited number of times, so they retain the biology and the behavior of the primary tumor or the parent tumor from which they were established. So in this collection, we characterized patient-derived xenografts that we established, particularly focusing on the disease that is under study, there's a big research program in our institution for HER2-positive disease. What we found is that co-occurring alterations such as mTOR alterations or RAS alterations can alter the behavior of HER2-positive disease. And it's important to consider those and to use those patient-derived xenografts that appear to be recapitulating the biology of the tumor very accurately. And what we found is that we were able to establish 112 patient-derived xenografts with engraftment rate of 41%. The variability of engraftment rate is dependent on whether or not it's a primary tumor or metastasis, but histologically, once the PDX is established, it recapitulates the parent tumor in terms of HER2 expression and other histologic factors. What we've also noticed is that using these PDXs, we're able to biologically identify the significance of some of these co-occurring variants of unknown significance. As we're showing an example of a validation experiment that we did with one such PDXs, where mTOR alteration was a resistance mechanism to HER2 inhibition, and we were able to overcome that resistance mechanism with combination with anti-HER2 inhibitor and mTOR inhibitor. Again, highlighting that some of these variants of unknown significance may have a significant driver in the disease. And the only way we would know for certain is to target these in therapeutic experiments and perhaps then design future clinical trials that are rationally targeting and combination strategies that will help us overcome therapeutic resistance in HER2-positive gastric cancer.